Welcome back to the morning show here on Arise News.
I'm Ruben Abati.
I'm Oji Akpi. Experts have shown direct links between efficient health system governance and promising health workers' output, which ultimately have positive effects on overall health outcomes. However, access to quality drugs, distrust, dissensions, and recurring conflicts among different professional groups in the health sector are some issues that have conspired to ensure that poor health outcomes still persist throughout the country. Joining us to discuss improvement of health outcomes in Nigeria and research and development in the industry is the Vice President of the Nigerian Academy of Pharmacy, Lere Baale. Good morning, sir.
Welcome to the morning show. Good to see you.
Nice to meet you too.
Thank you for joining us today.
Thank you.
Okay, so let's start. I want to talk about more traditional medicine in Nigeria. Would you say that there's adequate research and development in natural medicine products in Nigeria? Because I see that that's a place where Nigerians really go to, given the scenario and the economic space here.
The Nigerian as a country has tremendous opportunity in the traditional medicine aspect. However, because of the process of development of medicine,
yes,
it requires that government should intervene to assist, to support through adequate research and development that will enable the traditional sources of traditional medicine to be developed to a level that we can now start to export them in a proper form, proper dosage form. And so the pharmacists are in a good position to help in transforming some of those medicines that we refer to as traditional medicine into commercial forms of medicine that can be sold within and outside the country and can also be prescribed.
Of course, this will contribute to our...
Yeah, but you see that there are many kinds of drugs out there.
That's correct. Including
aphrodisiacs, including all kinds of herbal formulas for a whole range of things. And some of these are, certified by the Food and Drug Administration Agency, NAFDAC. As a pharmacist, are you concerned that people are just dispensing drugs without being professional pharmacists under the cover of providing alternative medicine?
Fine. When you say a drug has been approved, approval does not mean that it should be misused. Like any other thing, we do misuse even ordinary telephone. That doesn't mean that it is not an approved means of communication. And so when a drug is approved by NAFDAC, it's not approved for purpose of being misused. It's approved for orderly usage. However, it's human beings who could misuse them. And the fact that the number of drugs that are being misused is a sign that there's a significant room for improvement in terms of control, in terms of distribution, and in terms of supervision. Like you also see in other aspects of our country, there are cases of disorderliness here and there, where area boys do a couple of things, political talk, does a number of things. It doesn't imply that there are no policemen or there are no people in the armed forces, but you still find out that it does happen. Because we do not have enough monitoring system. We don't have enough people to monitor, to ensure that people are quickly arrested and prosecuted for whatever they are doing. So that gives some leverage to those who are doing the wrong thing to continue.
So in other words, you are saying that NAFDAC does not have enough capacity?
They require additional resources in terms of, not just in terms of money, but in terms of support from the various, maybe police, as well as armed forces to get things done.
Okay,
because those who are into drugs, they can do any kind of thing, and so ordinary civilians cannot just walk up to them and say, you're automatically arrested.
Okay.
Unlike what happens outside the country where there are special forces to support in cases like this.
Okay, let us touch on abuse of drugs in Nigeria. People self-medicate a lot, especially like I recently read about the ban of codeine in Nigeria, and obviously other drugs like painkillers are abused here in Nigeria. So what do you think can be done to enforce this type of use in Nigeria? I know I'm from the US, and I know that before you could buy medicine like cough syrup, you have to get a prescription, and also everywhere in the first world countries, you need prescription. So what's going on here in Nigeria, and why has that not been a case here?
Let me first and foremost correct you. I worked for a US company for 25 years, okay. Pfizer, precisely. In US, you can actually get some medications without prescriptions. They are referred to as over-the-counter medicine.
Yes, over-the-counter medicine, now, but not for like young adults?
Yes,
or
I
young
want to explain it to you.
Right.
So in Nigeria, there are 3 categories of medicines.
Right.
There's over-the-counter medicine. There are medicines you can walk up to pharmacies, and pharmacies could give to you, maybe like derma preparations and so on and so forth. Then the 3rd categories of medicines are the prescription medicines that require prescription on.
That's what I'm touching on.
What has happened is that over a period of years, because of inadequacy of healthcare practitioners, large number of people have had cause to walk up into pharmacy shop to collect medications that ordinarily should have been based on prescription. And therefore, particularly when they are refilling their medicines, particularly chronic therapy patients, if somebody is diabetic and he needed to refill his prescription, he can go to a pharmacy shop with a copy of the old prescription and get the fill. What is not right is for somebody to walk in and get medication like antibiotic without a prescription and some other prescription medicines. And the reason is inadequacy, the waiting time. I also served on the board of a teaching hospital for about 8 years, and I was able to see the problems between the primary healthcare centers, the secondary healthcare centers, and the tertiary. A couple of people go all the way to tertiary institutions like the teaching hospital on cases that should have been taken to primary healthcare center. So the current government is doing a lot to improve on situation at the primary healthcare center level so that number of cases that go to pharmacy shop to collect medicine that are supposed to be on prescription, but at least take their prescription from primary healthcare centers. And from there, if their cases are not resolved, they could go to general hospitals, which is what we call the secondary healthcare centers. And if cases are not resolved there, it could be escalated to teaching
President
hospital.
Obasanjo was in Senegal recently as chairman of the Commission on the Abuse of Drugs in West Africa. And was making the point that, persons who abuse drugs should be decriminalized, that governments across West Africa should place greater emphasis on treatment and provide facilities to ensure that. What do you think?
Generally speaking, every time people speak about drugs, there are 2 categories of drugs. There are people who abuse hard drugs, the drugs we call like cocaine and things like that.
Yeah.
Then there are people who abuse normal drugs that are supposed to be medicine, that are supposed to be useful into the body. When they are abused, it is as a result of inadequate guidance and inadequate or over-treatment. Because there are cases where people believe that they become dependent on the drug, and without the drug, they cannot do much. Government should therefore spend more resources on preventive rather than treatment. Prevention, for example, means if I have access to a medical doctor within the shortest possible time, if I have access to the critical healthcare practitioners, and the products and services are not too expensive, then there's every likelihood I'll be able to just do what I've been asked to do without necessarily having to self-medicate. Self-medication and promotion of self-medication goes a long way to fuel the concept of medicine abuse.
If you look around Nigeria, you see a lot of, they call them chemist and patent stores.
That's correct.
And, you can even go there if you have a headache. You ask to be treated by this person whose only claim to pharmacy is probably having worked in the hospital in the canteen. And then you have the professionals. And the typical pharmacy stores are supposed to have a resident pharmacist. But you see many of those pharmaceutical stores too, they don't necessarily have experts. How much of a threat does that pose to the public health domain in Nigeria?
It's a major threat to public health anywhere in the world. But the difference is that in the rest of the world, particularly in the Western countries, there's sufficient monitoring. First, if you are not a pharmacist, you are not supposed to be able to open a pharmacy. So when you use the phrase patent medicine dealers and chemists, the patent medicine dealer system was put in place as an interim, post-independence, but we did not have sufficient number of pharmacies to open pharmacy shops. Today, there are a large number of pharmacists that are capable of opening pharmacy shops. But the patent medicine dealers, like you stated, they have opened and they are supposed to be restricted to category of products that are referred to as over-the-counter medicine. If by any means they are now carrying medicines beyond what they are supposed to carry, then that itself, it's moving beyond the boundary. And so the so-called chemist shop and so-called pharmaceutical premises that you refer to are not likely to be genuine pharmacy shops. When you are looking at genuine pharmacy shops, you normally see a green cross that comes directly from the Pharmacists Council of Nigeria, which is the regulatory body, and they will normally carry drugs that are supposed to be approved by NAFDAC. But when you are in pharmacy profession and you are practicing a profession for which you are not qualified for, you are there for a totally different reason. And so just like you have fake medical doctors, fake engineers, fake lawyers, we also have people who are practicing.
Well, thank you for not mentioning fake journalists.
But of course, you know that they are fake journalists.
Anyway, let me ask you
Yes, sir.
a slightly political question.
That's fine.
This rivalry between pharmacists and doctors in Nigeria, particularly in terms of appointments, either as commissioners of health or, minister of health in Nigeria, it's a big issue in Nigeria. And doctors say they are leaders of the team, and the pharmacists are just members of the support team, right? And it was a big issue when Prince Julius Adeluyi became Secretary for Health. So who is superior between the medical doctor and the pharmacist?
We are a family of healthcare practitioners, and there's no superiority between one and the other.
Doctors insist they are superior.
Yes, that's a political statement. I'm now discussing like a scientist. So there's a value chain for delivery of healthcare. And in that particular value chain, each person has a role to play. For example, one cannot do the job of the other person. A mother cannot be a father. A father cannot be a mother. And you do not come into the family and say, because I'm the head of the family, the mother, therefore the father will be the one to breastfeed the baby. So the patient is at the center of all that we do. And Nigerian Academy of Pharmacy has taken the initiative way back in May last year, where we gathered all the healthcare practitioners. We got the former Minister of Health, like Professor Itai Olambo, who was a keynote speaker, and a couple of different healthcare practitioners to talk around collaboration. When the center of attention is the patient, there's no need, there'll be no rivalry. But when there is politics, when there are other things that are involved, then politics come in. I've been a practicing practitioner. I've been a pharmacy practitioner for almost 4 decades. And all I can share with you is the fact that I've never had cause to have any major problem with any medical doctor that I've had cause to work with, either when I was in the industry, when I was in the hospital segment, or when I was in the community pharmacy segment. The reason is that there's a mutual respect. Each one of us is coming from pure science background. We possibly did the same course in A-levels, and many of us came up with very bright results. That's why we ended up in pharmacy or medicine. So it's not possible for one to say it's superior. Number 2, leadership is not a title. But I'm also a student of management. Leadership, it's not a title. It's not somebody in authority. Leadership is influence. It's inspiration. And so who comes up as a leader at any material time depends on what you are doing. When it comes to diagnosis, the medical doctor is in charge. When diagnosis is done, medicine is being prescribed. When it comes to monitoring of the medicine, when it comes to the usefulness of the medicine, the pharmacist takes charge. Therefore, it serves as a leader at that material moment. When it comes to the care of the patient, the nurse becomes the leader. When it comes to laboratory services, the laboratory scientist becomes the leader. And so the issue that the public, and as well as the media, is emphasizing is the few differences that exist between maybe one and the other individual. And it doesn't matter who is speaking. What is clear to me and to any professional in the healthcare team is the fact that all of us are keen on working together for the benefit of the patient. When our focus is taken away from the patient, then that's when interprofessional rivalry will evolve. And Nigerian Academy of Pharmacy has invested a lot of resource in money, time, for professional collaboration. The Pharmaceutical Society of Nigeria, of recent must have noticed the president, have also brought together the Nigerian Medical Association members, where they had a very useful discussion. And the NME themselves has come up to say they are willing to work with other healthcare.
And we will keep watching.
That's right.
The public perception of a pharmacist in Nigeria is that of a dispenser, so drug dispenser. So it's good you made the point about the Academy of Pharmacy. Now, what is the academy doing in terms of research? Because there's just so much emphasis on pharmacy, what is being done in the areas of pharmacognosy, pharmacology, to deepen research and make Nigeria more competitive in this field.
Thank you so much. Dispensing is just one infinitesimal part of pharmacy responsibility. Like we rightly stated, we are also very solid in research and development. We are good in pharmaceutics, we are good in pharmacognosy, we are very solid in pharmacology, we are very good in pharmaceutical chemistry. We are responsible for having an architectural design of medicine. And that's why you see an improvement. Nigerian Academy of Pharmacy had gone all the way to promote the concept of research into our local medicine. And one of the things that we are doing today is to actually give honor to two critical people. One, it's somebody who has invested all his entire life, almost 9 decades, working on pharmacy, Chief Oludolapo Akinkunbi, who is being given a lifetime award today. And today, we're also starting Oludolapo Akinkunbi Research and Innovation Center, which we did further through the collaboration with Nigerian Academy of Pharmacy into indigenous preparations, particularly some of the things you said from plants, from animals, and so there will be less investment, and there will be less need for us to import, and there will be more need for us to produce locally.
Okay, great.
We're also doing more in the area of pharmaceutics, looking for ways within which we can produce a couple of things in different dosage forms, not just in the liquid form, which we are used to, like agbo.
Yes, I
but
see
in some
people
other things,
carrying
it can now
Lagos
come
with
up in
that.
tablet, will come up in syrup, will come up in many other ways that will be acceptable to more Nigerians.
Okay, one question. How can the government truly control the distribution of drugs that can be easily accessed and abused?
Okay. I was with the Registrar of Pharmacists Council of Nigeria 2 days ago.
Okay.
And the Pharmacists Council of Nigeria, along with NAFDAC, they are working together to create a model whereby there will be specific centers for distribution. They are going to be approved distribution centers, so that in every geopolitical zone, there will be an approved distribution center, and using the cryptocurrency methodology or Bitcoin methodology, we're able to track medicine right from the factory all through to the end user. And because medicine will now be able to be bought not as a tool of commerce in the open market, but from specific location, it therefore becomes possible to get the medicine that comes from the manufacturer or from an importer and to be tracked all through to the user. And government is investing heavily in trying to set up these centers with the collaboration of the Pharmacy Council as well as Nigeria Agency for Food, Drugs, Administration and Control.
That's great to hear. Yeah. Thank you so much.
The West African region used to be a transit point for illicit drugs.
Hard drugs.
But now it's become a destination, a consumer market. What do you think is responsible for this?
We must understand the fact that, yes, like you said, it used to be a transit, and people would normally come from other continents through route of commerce, through the Mediterranean Sea. What is responsible for this has to do with the fact that first there's a demand, and there's people who are willing to buy in Europe, and then there's a supply point, usually from South America. And this had become a route. Unfortunately, the quality of life of people and the amount of access to wealth is also increasing in the West African region. And so the caliber of people who ordinarily would not use hard drugs are now into hard drugs. First, there are also a number of things that are not met. And then because of the political, economic, socio-cultural situation in our region, whereby we are producing large number of people who are jobless, and so they are trying their hands on a couple of things that ordinarily they wouldn't have if they had been fully engaged. We think that the youth should be fully engaged. It should be government responsibility along with the private sector. Government alone cannot do it alone. And we see that all over the world, including in Western countries, no government is capable of taking an initiative and completing it alone. There's a need, particularly in developing economies of the world, like in Africa, where we have an approximate about 1 billion. The next growth phase for the world will be coming from Africa. And therefore, we need to engage our youth. The youth is the future. And the more we invest in them, through government policies, through developmental economics, through private sector support with government, the better for us, and the less with the incidence of use of hard drugs.
Well, thank you very much.
Thank you so much.
Thank you very much for coming to the morning show.
I appreciate it.
This has been quite refreshing.
Thank you so much.
Thank
I'm
you.
grateful.
It's time now for a short break on the morning show. When we return, Arise News analyst Emmanuel Ifeanyi will join us to review some of the top stories on today's newspapers. Stay with us.